everyone. Can you hear me?
Hi, Erepere, how are you?
Can you hear me?
Good morning.
Hello, good
Hi.
morning.
Morning. Hey, Dr. Belema, so good to see you.
Good morning,
Hello,
Erepere.
everyone. Good morning. Good morning.
Good
So,
morning.
are we okay? We're going on in 1 minute. We're starting in 1 minute. Yemi, can you hear me?
Okay, just to say that I can, but I'm going to change my internet around, I think. So if I should go off, I'm going to come back on again. Okay?
No
Because
worries.
I'm switching
Okay.
between internets.
Okay, so we are starting now. So can we start recording now? Okay. So good morning, everyone. Once again, welcome to another edition of our episode 2 of our weekly series focusing on MS and other autoimmune illnesses, and basically talking about how it affects us on the day and what our experts have to say and advice that our experts have to give us. So today we have Dr. Belema Abbey, an awesome physician. So she is from Rivers State, and Dr. Belema is actually, believe it or not, she's actually a dermatologist. Now, but the awesome thing about it is that she's a dermatologist, yes, but she also deals with autoimmune illnesses. So imagine how awesome that combination is. And she has a lot of experience dealing with autoimmune illnesses in River State. She has a lot of patients that she's working on. So she's going to help us shine some light on the situation. And she's younger than Dr. Gerald. Yeah, so she has, a more youthful exuberance, more coming from that perspective, be more, exciting to listen to. And then we have Yemi from last week. Yemi is an exceptional human being. I can't say it enough. She has dealt, or she's one of those people that, when I feel, like when I need to kick MS, give it a punch, I call Yemi because she basically knows, how to get me in that zone, how she has managed it for 20 odd years, 4 children. Lord God help me, I don't know, 10 years, and I'm thinking that I'm about to just kick the bucket. Ask me. And so that's our awesome EMC. And we're supposed to have my friend Chimdalu. Is she on? Mrs. Nwosu. She on yet? No, I don't think so. But Chimdalu, Mrs. Nwosu was diagnosed. When she's been my friend for about 15 years, and initially at some point we thought that it was MS that she had, but we found out much later that she didn't have MS. She actually had something called Guillain-Barré. Let me see, have you heard about that?
Yeah.
Guillain-Barré. Am I pronouncing it properly, Dr. Abbey?
Yes, Guillain-Barré. You're right.
Guillain-Barré, okay. And she's a mother of 3. She's a tax lawyer. She's a pastor. And she has lived with it for 2000, since 2014. Like I said, initially we thought it was, she's a mother of 3. Sorry, not a mother of 4, she's a mother of 3. And she's married to an awesome pastor. So yeah, those are our speakers for today. So without any further ado, I'm going to open up with Dr. Abbey. So Dr. Abbey, what I wanted to, we had this conversation during the week, and thank you so much, really, for taking time out of your very busy schedule to, time this morning. I really appreciate it. You have no idea. So basically, I wanted you to just give us a summary. Like I said, the meeting is about 40 minutes, so we won't exceed that. So just to give us a summary, tell us what your experience has been dealing with autoimmune illnesses. Just give us a brief history and, basically just tell us about yourself and how you have dealt with autoimmune illnesses in your profession.
Good morning, everyone. As she has rightly introduced, Belema Abbey. Morning. I usually don't start with doctor. I don't know why. I'm Belema Abbey. I happen to be a consultant physician, specialist in dermatology, and also have some training in rheumatology. That's the specialty that deals with autoimmune disorders, that's of the bone and skin. So yeah, she's right. I practice in River State University of Port Harcourt Teaching Hospital, Department of Internal Medicine as a consultant. And my experience with autoimmune disorders will span from my training as a younger doctor and to a consultant. So prior to this time, let's say about 12 years, 10 years ago, autoimmune disorders looked like it was rare because first things first, we were not meeting them. We knew the theory and we were not seeing these patients come to us. And when they do, patients are largely indigent. They can't afford to have special tests done. Even when we want to order for these special tests, we can't find them being done in River State. We had one or two few labs that were in Lagos, and then one lab or so, then was Pathcare that was there for over 10 years now that would send their samples out of the country. And of course, imagine that it was quite expensive. So there were multiple reasons why autoimmune diseases were not in our face as compared to now, when we are like, my goodness, what's happening? Almost everybody has an autoimmune disease. If it's not the skin, it's the bone. If it's not the bone, it's the nerves. It's almost, and autoimmune diseases affect almost every system. Whatever system is the primary trigger for the autoimmune disease, it almost affects every other system of the body for any particular autoimmune disease almost. So, but right now we are seeing like an of autoimmune my clinic, and it's really surprising. So why is it so? It's so because back then it was, if it's not from your village or somebody amongst your family trying to hurt you or kill you, that's why you're having symptoms, persistent symptoms. Nobody's seeing you physically ill, then but you're always ill. You can't get up, you can't move your joints, you're having fever, treating malaria all the time. Somebody has to be chasing you. So it was either that, or when they come to the hospital, they couldn't find the money to diagnose. So we weren't seeing them. But now that word is being spread, somebody knows somebody
as well. Yemisi, we are more than we thought we were. Quite a number of us. So I would like I said previously, my friend Chimdalu we initially, when she started presenting, we thought that it was, I say we, like I'm inside her house, but we have been friends for close to 16 years. So we pretty much know everything there is to know. So we thought it was multiple sclerosis for quite a long time, actually. And was taking medication for multiple sclerosis, and eventually found out that it wasn't. It was actually Guillain-Barré, which I'd never heard of. So I would just, before we go to Yemisi, I would like Omuso, if you could just tell us about the experiences that you had presenting with this illness here in Nigeria, how it has affected you, your mindset, your family, your mental health. If you could just give us a brief, talk to us about that.
Okay. Hi, everybody. Thank you very much for having me. Good morning to all the panelists and to all the guests here. And thank you very much, Erepere, for starting this in the first place. It's an amazing initiative. Asking me to give you my story and how it's affected my family, my mental health, and my experience in Nigeria. I can't do that in, in 5 minutes. Yeah, but the honest truth is that it has been horrible. Like,
She frozen on your end. Yemi, she
Yes,
frozen.
yes, I thought it was me
What we're
actually.
experiencing in Abuja is something close to like a storm. So it's really windy and
yeah.
no, I think it's a.
Should I go on?
Dr. Belema, are you there?
Yes, I am.
Okay, she's back. Okay, she's back. Okay, sorry. I was just explaining to everyone that we are experiencing like a storm here in in Abuja.
Yeah.
The network is a bit glitchy, so just bear with us, and then we'll just take it from there. Seems like she's frozen again. Yeah.
No,
Chimdalu, are you back?
I am.
Okay, you're back. You're back.
Yeah.
You're back.
Yeah.
Okay, keep going. We're here. We're listening.
I am. Yeah, so I was saying that it's going to be difficult to sort of abridge my story and my experiences.
Okay.
Hello.
Okay, we're here. We're here. We're here. So if you're having any issues, please, I'll give you a call. Okay, so let's just get quickly, just give us a brief summary because the weather should allow us to, go through this. I pray.
Yeah.
Okay.
So it has been horrible. Of course, getting a diagnosis was like finding a dinosaur in the Wuse market. It was horrible. I went to every possible hospital, and at some point, I can't even. I mean, like you said, I should just give you an abridged version. But so at some point, I was just being treated for the symptoms, which is the pain, and everything. And then that for me was even a bit of some reprieve. I was getting some sort of relief from that because at least they believed me. My immediate caregivers believed me that I was actually experiencing pain. So for me, the most difficult part of this was actually getting people to believe that there was an illness, like the previous speaker has said. Having an invisible illness in this part of the world is horrible. There were many times that I had prayed that, can this illness show up on my skin? Can it show up on my body so that people would believe me? So yeah, it was back and forth trying to get a diagnosis. Eventually I was diagnosed with multiple sclerosis. But then about 4 years after that, so my first incident with this was in 2014. So 7 years ago. And then, there are just so many moving parts and I don't want to take all the time. And then our network is the way it is. So I'll just leave it at that. It was very difficult to get a diagnosis. Getting my immediate caregivers to believe me in the first place was an uphill task. But then they began to believe me when for absolutely no reason. I would just fall sick. I lost my job. I lost a lot of things. So they eventually started believing me, and then we started going from pillar to post, trying to get proper diagnosis. As you said, I was diagnosed with multiple sclerosis about a year ago. I was finally properly diagnosed with Guillain-Barré syndrome, which is a sister to multiple sclerosis. It operates in the same pathways. The only difference is that it does not affect the spinal cord. It affects the extremities, so your hands and your legs. And that's the only difference. I think I'll leave it at that for now, and I guess there are other questions that will come up later.
Yes, because
hello?
I was reading. Can you hear me?
Yeah.
I
Can you hear
yeah,
me?
sure. Yeah. Yes.
Okay. Hello?
Yes, we can hear you.
I think we can hear you. Yes.
Hello? Seems like we're
we
all
can hear.
frozen.
We can hear you. Mama, we can
Can you
hear
hear me?
you.
Okay.
Yes, we can hear you.
Okay, thank you. Abuja weather is horrible. The storm here is just, let's not even go there. I'm really scared. Okay, so the that was one of our issues. Like, yeah, see, when we talked about it last weekend, we realized that, getting people to appreciate, to understand, to believe that this was something that we were going through was an uphill task, right? And it was something that, people would
Yes.
say, what is a figment of your imagination? I
It
experienced
was
that at work as well. You can imagine typing and your hand will just freeze. Your hand will just stop working. And how can you explain that you cannot continue to type? So I used to sit down with my good hand with a pen and be punching the keyboard, one after the other. And obviously putting more strain on my other hand. So see, Dr. Belema has also more or less said to us what Dr. Gerald spoke about last week. So can you tell us from your own research that you've done over time, from your own experience over time, which we talked a little bit about last week, but from recent, 20 years ago and now,
Sorry, you've frozen. Frozen. Is she not on anymore?
I think she
Can you
is.
hear
me? I
me?
was kicked out.
We can hear you now. Yes.
This is a wonderful experience, Abuja weather. So Yemi, see, just briefly talk to us about your own end.
Erepere, are you still on?
Is she there?
I can hear
Okay,
her. Yeah.
I can talk a little bit about my experience when it came to being diagnosed. I honestly thought I was going a little bit crazy at some
Yeah.
point. It was difficult to believe. Nobody could believe me. I could barely believe
Yeah.
myself. I was
Yeah.
wrongly diagnosed. I was wrongly diagnosed with cervical spondylosis at first. It wasn't until I started to use a cane, a walking stick, that people actually started looking at me like, there might be something wrong. Is everything okay? And yeah, I've always tried to create awareness. I speak about it everywhere. And then it was when I now moved from the cane to crutches that people were now thinking, okay, there's something really wrong here. I started to believe. But I know for sure, see, this condition, this autoimmune condition, is exactly like a spiritual problem, honestly speaking. I mean, if I were not educated and if I did not know better, honestly, it is like a spiritual problem. I mean, one minute you're fine, and then next minute you can't see and you can't walk for like 3 weeks, and then next minute you're better, and then next minute you can't do XYZ, and the next minute, so it's really weird until it gets to the point where when it all just starts to progress and there are no gaps in between periods of relief. And it's also very difficult for people to understand pain that they cannot see. So if you see somebody with an open wound, then you know that that person must be in pain. But if you don't see an open wound, you've got somebody grimacing and freaking out because of pain. It's very difficult to wrap your head around. So I sometimes feel for my caregivers and the people around generally, just trying to understand how to manage somebody's pain when they don't look like they're in pain. I mean, it's tough. I don't know if everybody got
It
that.
is.
I was
It is
Yes,
talking.
tough.
it is.
But one of the things, it is quite tough actually dealing with it on the day, running your life, running your everyday life as a mother, as a wife, or whatever, your daily responsibilities are. And that was why, like Dr. Belema, the other question I was going to ask you. Can you hear me? Thumbs up if you can hear me. Constantly having to ask this question. Thumbs up if you can hear me. Awesome.
Yes, I
Okay.
can. I
So,
can.
Dr. Belema, from your view, what I would like to find out is, how do you think we can bridge this gap? How do you think we can sort this out, for lack of the big grammar to speak. How do you think we can get from point A, being the medical, to point B, being us, the sufferers, for lack of patients or people with autoimmune illnesses? How do you think we can sort this out? Because there are a lot of people dealing with mental issues on this. I'm sure the mental issues aspect is even more than the physical pain itself for most people, you know. So how can we bridge that gap? I want to know from your opinion. What do you think?
Okay, so if I understand your question correctly, how do we bridge the gap between diagnosis, treatment, and dealing with living lifelong with this illness in as good as a mental health as possible?
Yes.
Is that your question? Okay, so
yes,
funny enough,
yes.
these few minutes of this conversation has just opened up something I never looked at. Seeing the emotional needs and your thoughts and feelings concerning managing your diseases is just something I never connected with. So seeing how you're struggling with, hearing it, not seeing, I see it when I diagnose and I manage. I mean, the patient comes in, I diagnose, I manage, I talk to the caregiver, encourage the patient, but hearing you tell me how you have to deal with managing this illness, even believing in it yourself, and coping with people around you, managing you, it's something I never connected with. So how we bridge the gap is, first of all, in diagnosis, is for every doctor to learn to send to a specialist whenever you meet any disease that is beyond your own subspecialty. That's one thing that is catching up with probably older doctors that are general practitioners. So there were few rheumatologists and there were few neurologists in Nigeria to diagnose these disorders, and they're still few. They're scattered in the country. So for a doctor to realize that this disease I'm handling, patient is not getting optimal results. I know I have not, in my mind, I've not gotten this diagnosis 100%. I need to send to a specialist. That's one, to get the diagnosis correctly. And then to treat the patient in totality. So I don't remember me sending, even if I know that the patient is grasping with, doctor, every day they come to the clinic, doctor, are you saying I'm never going to get well? But I'm better. I'm feeling better today. Are you saying this will never go? I don't connect that the patient is suffering with having to deal with this disease all her life, having to see her caregivers, her family members. I won't use the word suffer, but feel her pain along with her. So I have never sent this patient for psychotherapy, to see the neuropsychiatrist for most patients we don't, unless the patient has a CNS manifestation, different from what the diagnosis was. So that's one way that we can bridge the gap. A lot of therapy for the patient, group therapy for the patient and the family members. And that's basically it. And to realize that the patient needs mental health care, a lot than we ever thought of.
Yes, exactly.
That's what this discussion is opening my eyes to. Yeah, a lot.
A lot of mental health, not just for the patient, but also for their caregivers. For their caregivers, because it is, I don't know how to explain. It took me from believing that, because I was going through this, my caregivers would be able to just, jump on board and help. It took me from transitioning from that school of thought to say, oh, okay, they didn't create these people for me. They are going through their own mental grasping, it by themselves as well, coming to terms with it. So, patience on my part was needed. Does that make sense? Okay, when I'm having a flare, for instance, and someone literally needs to help me have a bath, some of us understand what that feels like. It's I don't want to use the word humiliating, but initially it's not
Not
something that
dignifying.
we enjoy.
Not
It's not
dignifying.
dignifying, exactly, Yemi. Exactly. Thank you, Yemi. That's the word I'm looking for. It's not dignified. And but then sometimes you will see it in their face, the way they're able to copy your body stuff. You know, I say, okay, if I could do it myself, I would. But they have to come to terms with it themselves. And so there's room for that. So support, not just for us primarily, but I think also because we have a tendency to think, oh, well, I'm the one with the pain. Yeah, but like Yemisi made a very vital point last week. She said, it's not just them taking care of you having to wait. That has been with me for the entire week. You having to wait until they're ready to take care of you. So you need to use the bathroom. You cannot walk. You have to wait. I'm coming. In fact, or they leave you on the toilet. Let's get down to it. They leave you on the toilet and you stay there for a long time because you cannot get up. And you have to wait for them to be done with whatever it is they're doing, or for them to be mentally ready to
To not go crazy is truly by the special grace of God. It really is by
I'm
the special,
telling you.
and that's when you really know
I'm telling you.
he's real and he's there and he exists. You know,
Yeah.
it's not an easy. It's not.
So you want to say something?
Yes, I want let me see. You can finish. I'm going to jump on what you're saying. So once she's done.
Carry on.
Thank you very much. See, for me, I'm actually fighting because I was not prepared for how triggering this conversation would be for me. Because in order to carry on with my life, I've had to put a lot of all these emotions somewhere in the background. How deeply this situation has affected my mental health. I'm not ready. I'm not ready for it. I'm not ready for this conversation. And everything in me is fighting, sending Erepere a personal message saying, peace out, man, some other day, because I really am not ready to deal with how deeply this thing has affected me mentally, because I have had to pretend to be so strong.
Oh yes.
And I'm not. Yeah. So and what is even more painful is I don't have much hope. I just feel like after this chit chat, it returns to normal. We're having this chat amongst people dealing with similar issues. I'm wondering when people outside are going to hear this, or when they're going to see the truth of what we're going through. It has been really very difficult.
No, but I think that's the whole point. I think that's the whole point of this whole conversation. I started a WhatsApp group, okay, because I was so alone. I was so lonely, right? I just thought I was the only person. I was young. I was frustrated. It was upsetting deeply for somebody who was very full of life and was up doing all sorts of different things to suddenly be cut short. Anyway, so when we put this group together, I found like there was lots of other people in Nigeria dealing with things like this. And I think that because we're now together, we're a little bit more empowered to do certain things, to sort ourselves out, to get ourselves. We're solutions oriented. How can we get better? That's the goal of this thing. I've just been attending a virtual conference, Terry Walls, autoimmune diseases and eating and the foods and all that sort of stuff. And it's been very interesting. In fact, last night it was all about resilience and how to manage our emotions. And the truth is that apparently every emotion only lasts 90 seconds. Physical pain in your body. If you can ride it out for 90 seconds, you can get over it. I thought it was very interesting. I'll tell you a little bit more about that offline, like a bit more information. But I just it's true. We can get over these emotions and we can forge ahead. I know I'm going to get well. We're all going to.
the thing is, this is therapy. Other people will hear. That's why we have created the platforms for other people to hear. They will hear and they will understand that professionals are going through this. It's not just a layman, a laborer, a cleaner. Professionals, intelligent, brilliant human beings, male and female, are sufferers of invisible disease. I have two sisters, incredible, lovely women who have fibromyalgia, and who've dealt with it for years and years. They're mothers, they're carers, they're professionals in their field. So it happens. So we speak on behalf of everyone, and we will get there. You know, that's why we're doing this. And I'm grateful to each and every one of you. You have no idea your wealth of experience, your being open enough to be open on this platform for the world to know what it is that we're going through, putting a face to the invisibility of this illness is beyond what I could ever hope or imagine. But the more we do it, the more, I'm just telling all of you, you're going to have one-on-one interviews with me on the Facebook platform. This Zoom will not allow us to be great. 40 minutes is not enough. They're already telling me time up. So, I want to say thank you.
Maybe we can get a sponsor to get us.
We'll try and get it longer. Yes. Yeah. But I want to say thank you, Dr. Belema, for being here and for sharing with us and for telling us from your opinion how we can bridge the gap. I want to say thank you. Your exposure today has been phenomenal, has been awesome. Thank you. Yemi, my MS kicker fighter. We are in this together, don't worry.
Thank you so much.
Thank you so much, Chimdalu. I don't know where
I came to share my experience, but your experiences have shone a torch in an otherwise dark tunnel. So I live here with another angle to my practice.
Okay. We have 1 more minute. So thank you, everyone. God bless you. Thank you. And may your day be superb today. Have an awesome day. And next week we'll ride on, we'll keep going. So hope to see you all here next week. So have a wonderful day, everyone.
Bye.
Thank you.
Bye. Thank you. Well done.
Bye.
Bye-bye.
Thank you.